Next, we'll have a guest talk by Dr. Nimmy Joseph on the topic, Role of Developmental Pediatrician in a Multi-Transdisciplinary Team. She's a consultant and head of the Department of Developmental Pediatrics, National Institute of Physical Medicine and Rehabilitation, visiting consultant at Medical Trust Hospital, Kochi, former consultant pediatrician in Sanjo Hospital, Perambavoor, expertise in pediatric neurodevelopmental disorders, and specialized in autism, hyperactivity, behavioral issues, learning disabilities, scholastic backwardness, and adolescent health issues. And she's also the former consultant in Sanjo Hospital, Perambavoor, which I already mentioned.
Good morning, everyone. First of all, I use this opportunity to thank the organizing team for giving me such an opportunity, especially Mr. Joseph Sunny, who is the only one I know from the organizing team, who is the man behind organizing such a wonderful conference. And this is the first time I'm talking in a non-pediatric conference. So I wasn't very sure what to talk about because all these academic things which you discuss here is totally foreign to me. So I just thought to give an idea of what we do and appreciate the work of occupational therapists in our team. So I'm just going to the talk. Basically, a developmental pediatrician does a risk identification and surveillance for preventive intervention and early mediation, which simply means identifying high-risk newborns or high-risk children. When I talk, my clients are always patients and children, so I'll be talking about only them. So identifying high-risk patients and neonates or parents with children of genetic disorders and doing an early intervention or early detection. Then for children who are affected, a transdisciplinary team evaluation, review and follow through. Then intervention and management in a transdisciplinary and transsectoral context. So, and also the research and understanding of theoretical foundations and helping the social strategies and policy making, which is very important, especially in a developing country like India, where we don't have much of policies helping disabled or children who needs help. The focus of a developmental and behavioral pediatrician is children's development and behavior in the context of families and communities. These families and communities are actually the center of our action. The promotion of function and life participation by advocating evidence-based remediations. So these, everyone would be knowing, the groups of conditions which we usually see are the neuropsychiatric disorders like ADHD, ASD and all, and then developmental delays, and then genetic and behavioral issues and are the major ones. I usually focus mainly on autism because post-COVID, I used to see everything, but then post-COVID, the at-risk ASDs and ASDs are, more common, I should say, and the incidence from 1 in 65 has risen to 1 in 100 even in India. Though we don't have clear studies, CDC latest number is 1 in 65, and I think in our country also this much incidence is there. So the basic conceptual framework on a DBP works is on a clinical and applied research on the background of a local epidemiological data, and then does an assessment and interim support, then help in professional and public education, which is very important in the identification and seeking help in these conditions, and advocacy, then partnership with other service providers, which is also very important in our context, especially in our state and in our country. A lot of people do a lot of small things here and there, but then a general policy or for the real needy, there is no services available. So, for example, I work in NIPMR, a lot of patients from different parts of Kerala come there across the state. But then we'll not be able to cater all of them, and it will not be practically possible for them to get the services from us. So if we have connections with other service providers, we can refer to them and monitor it. So this is the role of DPP in protocol and framework, which I have already discussed. Now, I think this is enough from a developmental pediatrician's point of view, and what I want to highlight in this group is, I see a lot of centers, private centers where, occupational therapists, speech therapists and other therapists work. Whenever a child reaches there with, usually there'll be multiple disabilities and multiple issues, only the problems which is under their control will be dealt, and no proper reference or no addressal of their medical or neurological issues is being made, or a proper review has been referred. So many a times these medical conditions or associated conditions go unnoticed. So always, DBP basically doesn't do much things. They do the job of a traffic police basically. Referring to all the therapies required in addition to addressing the medical conditions. So please take, medical advices or neurological advices whenever you feel it is needed. So, these you all will be knowing, these are the pediatric conditions which an occupational therapist deals with and what they do. I don't have to tell you this. So I thought I'll take this opportunity to talk about our institute, because we have visited, quite a bit of institutes in Kerala and all over India also. Not much, but then I couldn't find any institute who has all the facilities like our institute anywhere. So I'll be focusing on the occupational therapy department part of our institute, though we have a lot of programs running. So this is our sensory integration and therapy area where we cater OP patients. Then we do have intensive training program for the ASD, which I would be coming later. Then we have autism school, CP school and an IDD school. So all these children, occupational therapy part, the sensory integration part will be catered here. And this is our pediatrics room. This is an room, there are 3 rooms with extensive facilities. This is our neuro-rehabilitation area, which has been used by children with neurological issues and also the adult patients in our spinal cord injury rehabilitation unit. We have an SCI unit with 8 inpatients. They stay there for how much of duration needed with getting all the therapies. And this is the SCI rehabilitation unit, and this is the VR hand function unit in SCI. And this is the hand function training unit. This is our ADL apartment. This works as a model apartment. We do give assistance in helping these patients to customize their home or living conditions too. And this is our mental health and adaptability center. Then this is a virtual reality room. This is one of the first in Kerala. I think 1 or 2 were there before. And now newer versions has come. Still, this is working well. This is like really good. Then ergonomics lab. Yeah, this is about the Little Steps. Little Steps is actually an intensive training program for children with ASD. We do have 3 groups for that: Little Steps, Bright Steps and CP Steps, where we actually make the parents to do therapy. This is an intensive training program where all the therapies required for a child is being given daily. And this is our prestigious program because we have very good results from these programs. Little Steps is for children less than 3 years. 15 children in 3 batches will be given therapies and training in a day. and the duration of the therapy is for 3 months as of now. We are planning to extend it with the extension of some facilities. So usually children of 2 to 3 years show very good improvement. I mean, at least 60 to 70% of them will have a very good improvement in their MCHAT scores after therapies. And this is the this teams consist of a developmental pediatrician with social worker and all associated things, and basically run by occupational therapists. I mean, our children, our kids, occupational therapy staff and students do a lot to run the program. So basically they do the basic work, and I just, say this is that and this is this and all. I don't have to do, because each children are different, and we do have team meetings every week. We discuss what has to be done, and they themselves come up with new ideas to train them. And this is Bright Steps, where we cater children from 3 years to 8 years. Initially this was thought for all developmental disabilities, but then now we have shrunken to only ASD, and this gives a good results. And and then we do have a CP Steps program too, where we give physiotherapy also in addition to this occupational therapy, speech therapy, and special education in case of children above 3 years, and developmental therapy in children below 3 years. See, we do have a separate enrollment program for all these, and we do have documentation of an initial their profile, including all, Indian scale of autism, then sensory profile, everything, and in the end also we repeat the same and document the improvements. Above all, the parents are being capable of managing the children at home and give basic therapies at home. This is our aquatic rehabilitation center. Quite a few staff from our occupational therapy and physiotherapy has been trained in giving aquatic rehabilitation, which has been used for children with cerebral palsy and ASD and all, and also for adults. This is instrumental gait and motion analysis lab, and such a sophisticated software-based lab is the first in Kerala. And these are our projects: the cerebral palsy rehabilitation and autism rehabilitation. Then we do have a musical garden outside. We have an indoor play area where we can use wheelchairs and all. And this is the experimental work area for customization of equipments. Sensory garden, then a sensory park. This is our MWOC baking unit, where do have a lot of children with disability above 18 years. We had a cake, I forgot to put the food. We had a cake fest and all every year. They do a lot, they put outlets for all the programs which has been conducted in NIPM. And this is the recreational pond, pottery and ceramic unit. And these are customized for outreach programs. We have a Rehab Express, Rehab on Wheels, and Wheel Trans, customized for giving, and this Rehab Express has that audiology area and all the assessment areas customized. So we go all over the state with this, and in underserved areas, even this tribal areas and all, for assessments, and we go for reassessments and once a month therapies and all. This is one of the accredited center for WHO on training on assistive products. I'm not very well versed with actually assistive technology and assistive products. And we do have a simulation supermarket for training our kids with cash concepts. And small children, we take them for getting the buying concepts and all, and we train our children more than 18 years, and there are some children are employed too there with remuneration. Yeah, I think that's about it. And one thing I wanted to highlight was I always used to think only pediatricians can handle newborns. So I do work in Medical Trust Hospital here. So the neonatologist asked me to take a class on developmentally supportive care. So I borrowed one PowerPoint from one of my friend who does that. Then I modified it and prepared for a week and all, and I came to the hospital to take the class. When I went to the NICU to take the class, I found everything I have mentioned has been practiced in that unit. And that has been done by our occupational therapy staff. She was actually new. She was only like 2 months or 3 months in the department, handling the department by herself because I am just a visiting staff. And she taught them everything very beautifully that I didn't even have to wash my hands. I was so happy to see that, and that gave me more, impression and outlook on the occupational therapist role. And most of the programs in NIPMR, the basic therapy, the patient service is being handled by them, and very good feedbacks and very good notes. So I appreciate the work of occupational therapists in the field of rehabilitation. Thank you so much.
Thank you, ma'am, for such a nice presentation. I would like to request Dr. Pratibha Vaidya, ma'am, to please come and felicitate Dr. Nimmy Joseph.